Good morning, everyone. One of the most important topics in research ethics that we will be discussing today is the ability to consent to research. In order to ensure that study participants comprehend and voluntarily consent to participate, this is an essential step. Fundamental concept from Milton's works, as well as broader and moral and legal principles, serve as the foundation of our discussion. Okay, so we're going to talk about some reaching points. One thing would be talk about how someone can agree to research being done on them. Find out the main idea behind how to tell if someone is qualified. Think about the things that make you skilled. Talk about the problems that happen when you mix moral and the law. So before we begin, let's review our main objectives. By the end of this presentation, you should be able to define competency, understand how it is assessed, recognize ethical and legal difficulties, and recognize challenges. So let's start with the basics. What exactly is competency? In this context, competency is defined as the capacity to make and educate decisions about participating in research, understanding the information, appreciating its importance, assessing our options, and coming to a decision are its four fundamental components. To put it simply, an individual must be aware of what is expected of them and make a decision that aligns with their own values and interests. Competency versus capacity. The main things to consider. Courts are told by the law how to decide if someone is competent. It is the job of the researchers or doctors to give medical advice, which is known as capacity. Don't forget, the competency isn't just being able to do something. Competency and capacity are sometimes mistaken. Competency is a legal conclusion reached by the courts, whereas ability is a clinical evaluation made by professionals such as doctors or researchers. A person may have very numerous degrees of capacity depending on the complexity of the decision, but only a court can declare someone incompetent. This distinction is critical for research ethics. Tips on how to do the right thing. In this slide, the basic ethical principles are intimately linked to competency. First, autonomy. Everyone has the right to make decisions about their own bodies and participation in research. Second, compassion. The researchers must ensure that participants' well-being. And thirdly, justice. Fairness is the choice of and handling of study subjects. A framework of assessing and maintaining research capability is provided by these guidelines. All right, on to the next slide. Making sure they're competent. So, how can we determine whether a person is able to give their consent? Researchers use a range of methods, including structured interviews and cognitive tests. So, to gauge an individual's understanding of the research and its risks, communicating in a way that people can understand is essential. Taking into account factors like cognitive limitations. It's hard to tell who is competent. Competency determined is not always easy. Some individuals, such as young children, the elderly, or those with congenital impairments, may require more care. Additionally, some researchers use abstract or highly technical subjects that participants could find challenging to fully comprehend. Researchers must carefully navigate these challenges to maintain their ethical integrity. All right. The laws and rules that make up federal rules, the institutional review board's policy says that consent must be given after all the facts are known. According to federal and constitutional rules, informed consent is legally required. Court decisions on cases involving competency and research have influenced our current understanding of consent because different countries may have different definitions of competency. Researchers must adhere to the law. Research-based knowledge and skills. Things needed for consent, being able to understand the facts of studies, ability to understand the effects of participating, making decisions, and weighing options are examples of reasonable skills. Communication, being able to make your choice clear. How can we ensure that participants understand these challenges completely and are capable of making informed choices? It is possible to simplify consent forms, provide visual aids, set aside time for questions, and if required, include legally appointed representatives. The goal is to give individuals information that is simple to understand. Few studies. To apply what we've learned, let's look at two case studies. If a person have mild congenital impairment, how will we assess their competency? Or consider a youngster taking part in a clinical trial. What special consideration must be made? Let's discuss potential more reactions to these circumstances. How would you assess these competencies and ensure ethical consent? Good question, right? Summary and takeaways. Competency is crucial to ethical researchers' practice. Assessments must balance autonomy with protection. Researchers have an ethical obligation to facilitate understanding. Always consider legal and cultural context. To sum it up, expertise is a crucial element of ethical research. It is necessary to ensure that participants understand, value, and can justify their decision to participate. Researchers have an obligation to promote voluntarily and informed consent despite ethical and legal concerns. Question. How do you think competency assessment should adapt for vulnerable populations? Hmm, thank you. I hope this reading and this teaching was very clear.